did my PowerPoint slide only because I don't want Tanya to push that bell. These are the rights. As you can see, there's 10 of them. If you study them, look at code, look at right number 1, respect. Oh, that's interesting. Fair treatment, getting even more interesting. Dignity and independence, appropriate standards, effective communication, information, choice and consent, support, rights during teaching and research, and your complaints are taken seriously. These are the consumer code of rights that the HDC promote and protect. Each and every one of the health providers must uphold the consumer code of rights. Already, because of the silence in the room, I'm hearing that this is probably one of the first times you've ever heard that, especially Māori, that we still have rights. I thought our rights were taken away from us when the ink dried up, when they signed that thing called Te Tiriti o Waitangi. We still have rights here in the health system. And it's our responsibility as HDC to get out in the communities and advise our whānau of that. But also to work with providers to understand the consumer expectations of these consumer code of rights and how they can provide better services for our whānau. Because at the end of the day, we all have the right to quality of care. This is our team. This is our governance team. Morag McDowell is our commissioner. Carolyn Cooper is the aged care commissioner. Deborah James is the commissioner for complaints resolution. Vanessa Caldwell has many portfolios. She has the corrections portfolio. She does the strategy portfolio for HDC, and she's also mental health. She has the mental health portfolio. Rose Wall, she has the disability portfolio, surgical mesh, and also maternity. And of course, I'm the 5th governor. The commissioner is the board as well. So we are the governance board of HDC. Director Māori sits with these mana wahine, and we are the governance of HDC. I want to bring us to the one particular space within our whole team, and that's complaints resolution. Here now in HDC, all Māori complaints must come to the Māori director. All Māori provider complaints also come to the director Māori as well. I need to make sure that all of our Māori providers who may have a complaint laid against them, that they're actually at the start line for when we start our investigation. Not around the back of the car park, still coming down the road and being, you talk about all those inequities. We know all the inequities, even with our Māori providers. So it's important to ensure that they have the same equitable investigation as everybody else has. Some of the common themes that we're seeing, and this is now working with our team. When I first started in 2022, HDC receives 3,500 complaints a year. Māori complaints were only sitting at 4%. Through the Kumara Vine, they increased to 7. Now they're heading up to 12, and now they're sitting around about 17, projecting to 22%. So we are now building that trust within the communities, and they now know about the cultural complaints process that we've implemented within HDC. These are the themes that we see. Lack of cultural intelligence, cultural awareness. We all know that anyway. Lack of clear communication information to whānau. Yep, maybe not communicating to whānau well enough, or even communicating to the people that we deem as our spokespeople within our whānau. And that may mean mokopuna. Lack of cultural support resources for whānau as well. Sometimes it's better not being diagnosed, because once you're diagnosed, where's the supports and resources that's going to go with it? That's what many of our whānau say, is that, geez, it was better me not knowing. In the Māori Directorate's complaints are triaged, as I said. They're referred to the Māori Directorate. The team brings in all of the necessary supports that we require. There's a complaint review, and then we go straight into hui a whānau. No, he's talking about the whānau if the whānau are not at the centre. So then HDC sends out a pānui, connects with the whānau either through email or through phone call, and says, hey, we received your complaint. We'd like to have a hui with you. Now, that word whānau, they determine who they want to bring to the table. If they want to bring the Māori Welfare Women's League, they can. They want to bring their clinician, they can. They want to bring their lawyer friend, they can. You know, they determine who whānau means to them, whoever they want at their table. Because we know that many of our whānau have carried these trauma, carried this mamai around for many years. They don't have the confidence to complain at the time of the incident. 2 to 3 years later, they find that drive within their ngākau and they say, you know, we're going to raise this, and now we're going to raise it with HDC because we hear that there's a cultural complaints process that we now have trust that we're going to be treated and not judged. So we're starting to see all of this come into play. When we have that hui whānau, we listen to the whānau, we listen to their experience, and then we advocate exactly what they want us to advocate on their behalf. We advocate into every single process, part of the process within HDC. S14, section 14, where we send the provider a list of pātai, and they must answer in a timely manner. We also capture the whānau voice as well. If the whānau want us to ask the provider a few pātai, well, that'll go in the section 14 as well. The whānau voice is the center of the process for S14. That then leads into what we call our provisional opinion. Here's all of the investigations that's happened so far. This is our opinion. This is where we've landed at this point. We're still going to continue on with other pieces of engagement, and we will hopefully get to a final opinion with recommendations and our investigation completed, whether we find the provider has breached any of these consumer rights, or whether the provider has breached their own standards. Once that happens, we talk that through with the whānau. If they're happy, we go into the next part, Pohau Te Rongo. Pohau Te Rongo is an opportunity to bring providers and whānau together, because at this time we've been talking about each other. We haven't really brought each other together. Because one thing that we've found is that providers also carry this mamai as well. And many providers want to come to the table and sit down and talk about, you know, replenishing the wairua. Tukua te wairua kia rere, let the mamai go. And so we're able to then coordinate the opportunity for Pohau Te Rongo to be achieved. And this is where the magic happens. You don't have to wait for permission from the government to improve any policies. It can be done locally as well. It can even be done within particular hospitals, particular providers. Every provider wants to improve their service. Sometimes they just need to be supported in finding ways in how to do that. HDC, especially the cultural complaints resolution pathway, can help with that. And so much of the awesome mahi comes from huia whānau Pohau Te Rongo. And there's many examples where we've been able to implement or influence service improvement. But I come back to these code of rights. We need to get out there. We need to advise our whānau that these are the rights when they're accessing any health services. The Māori Directorate concentrates on the kupu Māori. So already we know there's going to be a breach of mana before our whānau even enter many of these hospitals or many of these services. Each and every one of us has mana. No one has the right to take your mana from you. Manaakitanga, we need to educate the system in and around what that actually means. Appropriate standards, tautikanga. Everyone deserves appropriate standards. It shouldn't be deemed by maybe your color or your age or your gender or ethnicity. Effective communication. Understand how whānau want to be communicated to. Not just Māori, but all cultures. And we can continue on and on and on. But we know that 1, 2, 4, 7, and 8 will always be breached, no matter what. That's the basis of many of the complaints that comes through to HDC. So I really didn't want to be a person who sounds like a prosecutor. I really want to encourage many of the providers to form relationships with us. So what I say then is that over the last 3 months, I've started our regional stakeholder uh, relationships because, again, our tupuna whā Te Puia Herangi has taught many of us from Tūranga Wāwai that you need to influence, that you need to, you need to influence the system. You need to be able to get out there and infiltrate the system and then influence from your position. Mahi a te mahi hei painga mo te iwi. You need to be able to do what you need to do for the betterment of others. If you can't, then step out of that role and let someone else do it. So we continue to sit in these positions of influence and provide opportunities of improvement for many of our whānau. I'm only really going fast so I can make it within the 15 minutes. But there's many cultural outcomes that we can talk about. Age residential care, Roman health, we've been able to help improve national processes and policies that they're now happy with. Maternity, we're bringing better awareness of whare tangata. Many people don't really treat our wahine with respect. And of course, many other areas of maternity. The cancer screening, really happy that we supported Hawke's Bay District, in particular improvement processes when screening particular cancers. And of course, now, currently, we have an Act and Code review where I think by law, every 3 to 5 years, we must review our Act and we must review our code. Our HDC Act was created in 1994, and nowhere in the Act does it mention Te Tiriti or even the treaty in that fact. So we're now pushing that Te Tiriti is within our Act so we can give practical effect to Te Tiriti to continue on the work that the Māori Directorate is doing currently. But then looking at ways in ensuring that this is not just for Māori, this is for all consumers. That we start picking up the phone and we start engaging with our consumers or complainants one-on-one. So without further ado, I think that was the last slide. Really just wanted to make sure I got in 15 minutes. And if you want any part-time, I'm sure we've got 1 minute for any part-time and engagements going forward. Cool, out there, Alina, tēnā koe. Yep, probably going to get myself in trouble, but I think it's 5 years. Let's just say 3 years for now, because I know that the complaints coming in 3 years ago are hitting my desk, right? But I know that there is a really lengthy time for whānau to put their complaints in. Yeah. Yep. Quiet. Yep, I suppose that's send me an email. Yeah, send me an email and we'll see what we can do. It might be a new pathway that we're going to create, but why not try it? Yeah, because tangata whaiora will be, these code of rights apply to tangata whaiora as well. Yeah. Yeah, geez, I started 2 years ago. 6 months ago, it used to take 327 days to hit my desk. Now it can take up to 3 days, straight from triage. I've received complaints now that have come straight from triage with 0 days within our organization. So we have improved our process a hell of a lot. And that's been through many of the criticisms that society has said about us, that our process is lengthy. Cool. I take that and I say, yep, here we go. Look, they're talking about us. I want to make sure that our cultural process, there are no delays. So as soon as they're received, comes through triage, I'd say 72 hours. They're sitting in my email, in my cultural advice email box. Yeah. Apai. Awesome. So yeah, so whānau, just, let's work together to influence service improvement. Let's not be afraid to engage with HDC. Send me an email. I'll create the relationship, and then let's work together through whānau voice, whānau experience to influence service improvement. Not yet. Yeah, we're getting there, only because there's only 3 of us at the moment, myself and 2 senior advisors. One of my senior advisors is sitting amongst you fellows, Kylie Tiarahi, but we are working on that. There is a national advocacy service as well, that you can ring, but that's an independent service to us HDC. So other than that, I really want to encourage engagements with the Māori Directorate. There's many providers here. I do want to follow up with you next week to talk about how we can form a relationship, how we can look at some of the particular themes that I'm receiving. In confidence, these are the themes. Do they relate to you? How can we improve your service? Nice and easy. Doesn't have to be rocket science. And I'm sure through kotaitanga, manaakitanga, and whanaungatanga, and all the other tangas, we can influence and improve the service. Nō reira, tēnā tātou katoa.
And what a difference it makes when you have people on the other side that are wanting to make a difference and not just run the same process that we've always had. Now, I think in everyone, if you go into any ward or in most health providers, you'll see the Code of Rights, a piece of paper. Has everyone seen the Code of Rights hang on the wall? And sometimes we've got to make sure that we don't become really complacent. And it's sort of just like another, resource that gets produced and just gets put on the side. So a good reminder for us, ikimoke, of how it should be actioned. And Kylie, where are you in the room? Oh, put your hand up so everyone can see where you are too. So there's Kylie over there. We're going to go for afternoon tea. I got it right this time, afternoon tea. I encourage you all not to run away, but to have a cup of tea, and there's still heaps of kai there, because we have one more session after afternoon tea, and then we plan to wrap up just after 4. So just a reminder too, also, that there's still food and plants and other bits and pieces which you're welcome to help yourself to outside there. And so with that, we'll go for morning, out. I've got this thing about morning tea. We're going to go for afternoon tea, and we're only going to take 15 minutes, and we'll be back in here ready to start at 3:20. Ka pai? Whoever's the first one out there, do karakia. Yeah, and big homage paki moke. Just the speakers who are coming this afternoon, can you just come up for the last session 5 minutes before? You're right. Kia ora koutou. Can someone karangatu ki rātou, those that are still in having a kai? Just, you can just call out to them to come in. Come up now. So we're just about ready to tuli, unless someone wants to do a waiata. We're just about ready to do our last session, which is on the Whiri Rangahau projects. And we're privileged to have 6 people here with us. So we've got Vonda Napier, Helena Tirohanga Kawhia, Dr. Nina Scott, Dr. Amy Jones, Lindley Uirata, and Deanne King. And so over the next 35 minutes, we'll be privileged to hear their kōrero. And so we'll start with Vonda. Omai te pakipaki. Go forward if you go.
Kia ora no tātou, e mihi ana kia koutou, ko tai mai, tēnei ahu. Ko Vonda Napier tōku ingoa, no te tai tuku rau, i te taha tōku papa. Oh, I can't stand.
That's right. On the side, in the middle.
Oh, in the middle. Can you see me? I'm so short. Kia ora. So in August 2020, I was diagnosed with AML, acute myeloid leukemia, blood cancer, and I was given 72 hours to live. So this is my sort of take on how I tried to save my life while I was in hospital. Later on in the journey, I was fortunate enough to share my story via whiri, and that's how I fit into whiri. Okay, what is that? Okay. So when I got sick, I had to take responsibility for that. And so I knew that my job was to restore my mana and my tapu real quick. So yeah, there's just some awful pics of what I had to go through, and my whānau right by my side. My brother was 100% match, so I was able to have a stem cell transplant. So what I want to share with you today is what I've developed the Mai Moko journey. So, and basically I got frustrated with the doctors because they'd come in my room, they take my pulse, they take my temperature, they write on their clipboard, and they walk out of the room. And I needed to address a whole heap of things holistically. I had a 12-year-old son at home who I just left. My job had been flushed down the toilet. My relationship was in turmoil. My rent, I was worried about how that was going to get paid. And, you know, the list goes on. And then I might die and don't have funeral insurance. So the psychologist walked in my room and she said, "You sound like a pretty intelligent person, Vonda. Why? What's the problem here? What can I do?" I said, "Can you go down to your office, grab 2 A3 pieces of paper, some sellotape, some blue tack, and print out Sir Mason Jury's Te Whare Tapa Whā model." And I went about writing all over it. All my pono, all my deepest, darkest secrets went on there, my worries and my stresses. And I wrote on it Vonda's treatment plan. And then I stuck it to my wall. The next day, the doctor walks in, he looked at my poster and he said, "How are you feeling spiritually today?" I was like, whoa, this is going to work. This is not how they talk. So anyway, long story short, I was able to restore my mana and tapu by addressing my holistic needs. I knew the doctors did their clinical work, that's their job, but I had to sort out my mind. Okay. The 3 Māori principles part of it, well, that's the pono, the tika, and the aroha. Okay, so for me, pono, po for me is dark, you know, no within me, the darkness within me. That's the first stage to change. Second stage, tika, reach out and ask for help. Don't be shy to ask for help. The third one was aroha. Now I got this take on aroha. Aroha, aro for me is direction. Ha, we've been talking a lot about ha today, is your energy. Yeah. So when you know your direction and you put your energy into it, you love it. So that's how I approached this life sentence I was given. So some people found out that there was this chick down in the ward that was talking about Mason Jerry's model, having all the doctors, charge nurses, even the cleaners running around after me. Why? Because they could see my treatment plan. And they'd come in my room and they go, I know how to do that. And they run down, run down and they'd sort it out for me. So anyway, I've ended up in a few groups talking about my approach. And at Te Aka Whaiora, again, I was part of the Whiri group in March 2022. It's now Te Whatiora. I'm still with them. Te Ahua Te Kahu, I heard some speakers today. I'm on the consumer advocacy group in Wellington, sharing my experiences. Leukemia and Blood Foundation, they found out about me, so now I'm on their board. Cancer Society, I help out at the Cancer Society in Tokoroa, just to give awhi to our whānau down there. I put my hand up to get a free trip to Melbourne, so that was cool. So yeah, just sharing my experiences over there with the Indigenous Cancer Conference. Where to from here? So my dreams and aspirations is that the doctors, nurses, whoever, the healthcare providers in the community, wherever, that you empower the patient. We know what we need. You know what you need. Just somehow have to help them get it out. And in my case, I put it on a poster. Culturally relevant treatment plans, well, you know, whatever that means for you is whatever it means for you. Indigenized clinical spaces. So there's a lot of great ideas. I kind of missed out on some of them. I was at a hospital appointment this afternoon, so when I did that and got back in time to grab some really good mātauranga. So I just want to thank you all for letting me share today. To you community providers out there, aki, kia ora, e mihi ana ki a koe. Yeah, you're all helping, and it's just about collaborating, so kia ora.
Kia o mata ki ka whia moana, ki ka whia kai, ki ka whia tangata. Ko te kupu tēnā a o tūpuna. Mauri ora kia tātou katoa. Rauranga tira mā, tēnā koutou katoa. Ko ai tēnei e tuana ki muri a koutou, ko Helena Tirohanga Kāwhia tōku ingoa. Huri tēnei ngō Ngātihi Kairo, ki Kāwhia moana, me Ngaitahu, me Clan MacLeod hoki. Tēnā koutou everyone. My name's Helena Tirohanga Kāwhia, and I hail from guess where? Kāwhia. So I guess I apologise in advance because for the next 7 minutes or so, I'm going to talk about myself. So aroha mai. How do I? So I'm going to talk about my hauora journey. But before I do, I want to give a bit of a disclaimer. I'm going to be talking about cancer, and I just want to acknowledge that I'm sure cancer has touched the lives of mostly everyone in one way, shape or form. So I just want to really acknowledge that, and you know, in a big whakaaro and aroha nui to everyone who is currently in a cancer battle or has sadly lost their life. So He Tirohanga Mārino is the name of my kōrero, a gentle sort of look, well, aimed to be a gentle look. So towards the end of 2016, I went for an elective surgery to remove an endometrial growth through the private sector. So unfortunately, I couldn't find help to remove this in the public sector. So we opted to go for, and have the surgery privately. And so a bit of insurance helped with that. I've got health insurance. However, my family and I went in several thousands of debt to have the surgery. There was a 15-year lead up to the surgery because unusually the growth was in my abdomen. And often during that 15-year period, my family and I, we would ask, could this growth be cancerous? Several times along the journey, to which the answer would be, no. The chances of that happening are so small. Oh, it's almost, so really, really such a small chance. There's no way. However, okay, so I went for the selective surgery towards the end of 2016, and the pathology results came back that it was clear cell carcinoma, so it was an endometrial cancer. So on being diagnosed, I was in a state of shock, and for the next few months, I lived in a state of fright mode. And so I had a whole heap of tests. And thankfully, after I was cleared of, if any further evidence of disease, NED, no evidence of disease. Okay, so that was pure, what a relief and how lucky. However, I did have a recurrence a further 3 times after that, in 2018, 2022, and 2023. Okay. So thankfully, holistic therapies in Rongoa, we're quite blessed because the taonga left behind by our tupuna have, some of those have been handed down to us, in our upbringing, and throughout, my life's journey, definitely have added more into the kete. So absolutely, during times of diagnosis, more so, that's what I would turn back to the taonga left behind by our tupuna. Interestingly, during times of diagnosis, those 4 times that I mentioned, that timeline, a healer of sorts would be directly in my pathway, a healer of sorts. So that would kickstart my clinical journey and what was about to, and it would give me the kaha before embarking on, the fight, the cancer fight. So aroha mai. So of course, I like to think the pictures speak for themselves, and again, an acknowledgement to our whare tapawha, which I've outlined there. And of course, the beauty of our tai ao. So absolutely, I would also lean into and literally touch, feel, smell, and taste the elements and the rejuvenating properties of our tai ao. Okay, so about mid-late last year, I was successful in being hired. I saw you there, yeah, Natalie, yeah. So I was successful in being hired as a kaifiri, a research assistant on a project called the Cancerwhiri Pilot Project, which the team will elaborate on shortly. It was awesome. It was such a buzz to be to land that role, especially because cancer is so dear to my heart. Several months into the role, though, I was re-diagnosed with cancer again, and so I commenced chemotherapy treatment. And it felt somewhat ironic that here I was supporting some whānau who were about to embark on their own cancer journey, and yet I was going through my own at the same time. Again, connecting with our tai ao and the beauty of the elements and all of that had to offer, helped pull me through and will help give me the kaha to show up and turn up for mahi and for myself. Okay. So I guess I count myself quite privileged. I feel a bit embarrassed to say that I've had the ability to access both public and private healthcare sectors. Each sector has their own strengths and gaps. However, but I'll just leave it there due to the sake of time. And I just want to say that I'm grateful for the care received. Nō reira, rangatira mā, tēnā koutou, tēnā koutou, tēnā koutou katoa.
Kia ora, take off the mask. Ko waia, ko te uri o Ngāti Whātua Ngā Puhimi Waikato. My name's Nina, and I am co-principal investigator of Whiri Cancer, along with Myra, who can't be with us this afternoon. And this is Amy.
Kia ora koutou, ko Amy Jones, tako ingoa no Pōnekia Hau, ko Pākehata Iwi. I'm the Research Program Manager in Māori Health at Te Whatuora Waikato. Been working with Nina for nearly 7 years.
Oh, yes, she knows all my ways, and I know all her ways. And the dress that Amy is wearing is,
Anyway.
yeah, we share that dress anyway. We take turns with the dress. So as you can see, I mean, you've heard a bit about Whiri today, and one of the things that Whiri does is elevates and privileges whānau voice. So that's why we always start off all of our hui, all of our engagements with whānau voice, because we need to be directed by whānau. And we're very honoured to have Vonda and Helena on the team. And we use a co-design. Whiri's a very basic, you know, it's a model of care, but it's designed and led with whānau. And you can design a Whiri model of care for anything, but because cancer is such an important kaupapa for whānau Māori, then we're doing quite a bit of cancer Whiri work. Amy, I haven't seen these slides, so Amy's just telling me what to do. Okay, I'll talk until you tell me to be quiet, Amy. So how did Whiri kind of started? We say it started in 2012, but it kind of started a little bit before that when we bought hauora providers actually from Te Koho Health into the paediatric wards. We had a service called He Tohu Aroha, and that was a smoking cessation service. Gosh, and that must be back in 2008 or something. But then back in 2012, we started this thing called Hāti Hauora Tamariki, which was a health needs assessment that we had in the paediatric ward. There were 21 questions with follow-up protocols. You know, if the tamariki's not immunised, then we provide immunisation. If they don't have a car seat to come to take the baby home in, then we link them up with Plunkett, who at the time were renting out car seats for $50 for 3 months or something. We did a randomised trial where we got that health needs assessment, which was just a list that was put in the paediatric notes, and we made it electronic, and we invited 1,000 whānau of hospitalised tamariki to take part, and they were randomised just by chance into whether they got usual care or the Hāti care. And then COVID hit, and we thought, what can we do with this tool that we've got, which is designed for paediatrics to support kaumātua during COVID? And it was pretty obvious because it was whānau centred. It was based on the wide determinants of health. So it had housing, it had, you know, wind subsidies, it had all of the, you know, the food banks, it had everything in it. Just needed a little bit of a tweak to make it work for kaumātua. We used the He Pekinga Waiora framework for all of the Whiri projects. So, and that's once again, it's just common sense stuff that we all kind of do it's kaupapa Māori centred. So it's really Māori focused, doing things in a Māori way, and using, really engaging strongly with people who are going to be using it. So whānau for one, and also the subject matter experts. So people who know about the stuff that you're doing. So that's how we did it. Should I just keep going? Yeah. So Cancer Whiri 1, we is from referral with a suspicion of cancer through to first treatment. So that's where things go wrong in the health service, because it takes us a long time to get from here to there. And we wanted to speed up that pathway. And there's a whole lot of reasons why that pathway is slower for Māori than non-Māori. But we know what they are, so it's not rocket science. So once again, it was things that we could fix. And we did it in partnership with whānau. And Steph pictured there was we knew we were winning and things were working well when our whānau took over and told us that we were doing it wrong and that we needed to take a moment, and actually this doesn't quite look right. So once you get to that stage and you've had that power shift and you are no longer in control, then you're winning. So but unless you get to that stage, then you're not winning. So I think we've oh yeah, keep going. That's a nice photo. Oh, you can talk.
Yeah, so we had an amazing group of wahine in our co-design group. We had 15 interviews conducted by Vanessa, who was working on our project at the time, with Māori patients and whānau who'd gone through a cancer journey during COVID. And we also had lots of clinical note reviews, thanks to DN. And all of that fit into our model of care for the Whiri pilot, which you can see there in the swirly green design. So those are our core domains of the model of care. And so we use those, I'm going to move things along, to conduct the pilot, which we only just completed earlier this year. We were hoping for 50, but we got 34 recruited and completed the FAR assessment with the clinical component for 33 participants. And Deanne was one of our researchers on the team, and I'll let her tell you a bit about the results.
Okay. Kia ora. Ko Deanne ki ngā hau. Yes, I was on the Cancer Whiri pilot along with a lovely Helena there. You can see her last photo, and that's Ash, who was the Whiri nurse across all the research projects. So as Amy said, we managed to work with 34 whānau. 33 we managed to do whānau hauora assessments with, but one of them was just too unwell to actually do the official assessment. But we ended up with quite a majority coming through gynecological referrals and to breast care. So we had about 74% female on the pilot. And about 24% ended up with a cancer diagnosis, and 65% not, it ended up being not cancer at all, and still 12% at the time the pilot finished was still no diagnosis yet. So as you can see, a lot more people, obviously it's not cancer at the end, but we're still wanting to support them through the investigations and that time of anxiety and everything that we've heard about quite a lot. So through the whānau hauora assessment, we managed to do, like what was spoken about earlier, a lot of referrals to and helping people with transport, parking, getting to the appointments, health literacy. We talked a lot and helped people. We gave out the Let's Plan for Your Next Health Visit sheet and that kind of thing. A lot of rongoa information. Everyone was really keen on hearing about rongoa early on in the process. So we provided information on local providers and actually referred a few people to try to have a try with a few sessions if they wanted to, and we did have a few take us up on that. But most of them, about 50% resided in Hamilton, so we were still having to always look for local supports in Paeroa, Te Aroha, Taumaranui, that kind of thing. So a lot of wider supports going. But Ash, also the nurse there, she spent a lot of time doing a lot of follow-up and pre-appointment phone calls, talking people through what to expect at their appointments, coordinating their appointments, prescriptions, that kind of thing. Yeah, and she also went to advocate with people at their appointments as well. And also a lot of mental health follow-ups. So in our whānau hauora assessment, we used the WHO-5 assessment, and if they scored low, we'd refer straight to her for a deeper conversation and referral if necessary. So she did a lot of, it was really pretty intense for her. Some of them were just one-off phone calls, but some people she followed quite a lot and we both did as kai whiri for like up to 3 months. So yeah.
Oh, I was just going to say, DN conducted the,
Oh, yes.
we did patient experience surveys after they'd completed the FIDI process with us. And there's a quote there from some whānau, but
Yeah.
really positive responses. And it wasn't a FIDI focused experience survey. It was more about their cancer journey. So including clinicians and everything. And it was 100% said that they felt that they'd been listened
Listen
to.
to, yeah,
So that was just one of the questions on the survey. So
yeah.
And that-
yeah, really
I mean,
positive.
given what Ikimuki was talking about, the communication's one of the big issues, the fact that the FIDI models
They're really high, yeah.
managed to make the whānau experience, positive from a communication perspective, even though we haven't managed to fix all the communication. It's the overall feeling is
Yeah.
good from whānau.
Having someone to talk to in that time of waiting was
go
very
back and forth
great.
with-
Grateful for that.
Yeah.
Yeah, and interpret the clinical speak and all of that kind of stuff.
So we've just finished the Cancer FIDI project. Another project we just finished is with 2 cohorts, Wahine Hapu and Māori with chronic conditions. They both are FIDI. There's a lot of co-design that happened and then FIDI pilots. And Lindley, oh no, this is me. Yeah. Wahine Hapu, so we did a lot of co-design. So Tina Beatty was the researcher there and she got pretty hoha with all the very long process of engaging with over 100 community members that, Māori health providers or midwives or people that support Wahine Hapu in all shapes and sizes. And that all fit into co-designing a FIDI approach for Wahine Hapu, including focus groups with mama and engaging with He Puawa, the teen parent unit at Fraser High School. So a FIDI approach and a whātu or hauora needs assessment was developed. It was trialled with 31 mama via community recruitment. Recruitment was hard. We finally got some traction by using Facebook, paying for Facebook ads. So that was good, but it was a bit too late and our project was finishing.
But the main thing
But
is the
good
co-design process of the FIDI approach. So we knew we'd done the mahi to design an approach that would work for Wahine Hapu. So that's the important part. And then it's just testing of
Yeah, it's
yeah.
feasibility more than
yeah,
anything. Yeah.
feasibility.
So some of the results, so there were a total of 345 unmet needs identified just with those 31 wahine. A lot of those were around social support or information about the National Travel Assistance. There was a big interest in food, nutrition and access to kai for the whānau, housing and unmet clinical needs. So Ash was also the nurse that supported our Wahine Hapu on the project. And that was provided for over half of our participants. They all engaged with Ash. Mental health was a really big one that she supported them with, along with pregnancy advice, diet, nutrition and medications as well. And there was a phone survey that we conducted with the participants that were provided with the clinical support, and they found that really helpful, very reassured by the service that Ash provided, with an average rating of 8.6 out of 10, which I'm pretty happy with. So, right.
So you can see we can, there's a range of hauora needs that whānau Māori have that the health services just aren't able to meet. And that the FIDI approach is a way of meeting a massive range of needs. And the overall goal is hauora game for whānau Māori. And that, you have a FIDI project that's, there's a cancer one, a Wahine Hapu one, a long-term conditions one, but the overall goal is hauora game for whānau Māori.
So Lily's just going to talk a little bit about, she's our researcher on the chronic conditions project.
And Lily did a lot of amazing systems level stuff. So as well as the individual needs that the navigator and the nurse are able to address with individuals and their whānau. Whenever there was something that the nurse or the navigator couldn't resolve, it went up to the FIDI systems team whose job it is to solve it, no matter how hard it is. And this is a lot of the stuff that Lindley's taken on. And there's some gnarly problems in our system, as you will understand too.
Ngā mihi mahana kia koutou. He uri a hau o Waikato ko Lini Urata tōku ingoa. So our whiri for Māori living with chronic conditions study focused on 4 health areas, respiratory, cardiovascular and renal diseases, and also diabetes. Our team talked to 21 Māori living with these conditions and 127 people working in those 4 health areas. And we drew on all of their different kinds of expertise and insight to then develop a hauora needs assessment that acknowledges the health determinants and also connects whānau to cultural support where needed. The evaluation that we did after the pilot showed that these conversations were really valuable because whānau told us what was important. They told us what to be careful about, how to approach things, how not to approach things, and also how to keep our kaipari safe and other things like that. And that really set us up really well to engage our whānau in the pilot. Led by our beautiful kaipari Tia Dagabo, we piloted the whiri with 30 Māori across the Waikato region, and our whānau was between the ages of 40 and 82, with even numbers across urban and Māori whānau. Most of them lived with more than one health condition as well. Cool. So a total of 331 needs were identified in our engagements with 30 whānau, and so that's about 12 per person, and these were the most common needs that they were living with. Over half of our whānau, so about 19 of them, were connected with our nurse and GP to help with some of their clinical concerns, and these are the key ones that they were living with as well. And this is just a really beautiful example of how one of our whānau were helped by our nurse using the whiri approach. So one of our wahine had a below-knee amputation and was waiting for physio and home cares, but no one had contacted her yet. So I coordinated that care. Where is the team at? Whether the referral had been sent, looking in the system to see what that referral status is, connecting the DSL team or the home cares team to let them know that this wahine had been discharged at this date, but still have not had someone come in to support her at home. That was pretty shocking, actually. That amputation was 6 or 12 months before, but she'd had a referral sent for PT and OT support, but it had gotten confused because ACC was supposed to take over, but then she got admitted to hospital again, and then DSL was meant to take over, so there was no communication between the two. So it's catching those unfortunate things.
And that's a classic whiri example, isn't it, Lindley? And I think a lot of the whiri nurses, that's the magic that they can do, is that they can find these issues and then resolve them really beautifully for whānau. And they're often not, you know, because whiri's whānau centred the case who the navigator's engaging with. I mean, you might get more hauora gain out of supporting the whānau than the actual case, because you know, there's unmet needs at every level.
So our new projects that we're starting are started late last year with whiri TB. Do you want to talk about this one?
Yeah, so TB is a disease of colonisation. I don't have TB, I've just got a cold. So people were brought to New Zealand sanatoriums, I think they're called, back in the day. Even when we knew that TB was an infectious disease, we still wanted to make money off it by bringing people here and charging them to come and stay in our TB hospitals. And the Māori population got to below 50,000 in the late 1800s, and TB had a large part to play in that. When it was discovered that TB was in fact an infectious disease, the then Ministry of Health put in a really good public health program to control TB in New Zealand, but it did not include TB control for Māori. And it wasn't until 1930 that you see the data start to be reported for Māori. And then it was shocking. The rates of TB deaths for Māori in the 1930s and 40s was massive. So you could see that it was running rampant through our communities. And then supposedly we got rid of it, but we actually haven't got rid of it for Māori communities. It's still endemic in remote rural Māori communities, and we're actually not doing anything about it. So this is what this project's designing, a whiri approach for TB, for eliminating TB for whānau Māori. So whiri focuses on areas where there are massive inequities like TB, rheumatic fever, but or areas where there's inequities and, you know, really large numbers of avoidable deaths for whānau Māori. So this is why we're picking up whiri TB. And we've only just started whiri TB, but we've already found some really big problems, which is great because we can fix them. Just like in the cancer pathway, we know the big problem is delays, and we can fix that. And we have fixed that with the Whiri cancer study, and we know we've pretty, it wasn't very hard to identify. Actually, it was a summer, my daughter did a summer studentship over Christmas and investigated all of the Māori TB cases in the Waikato over the last 5 years, was it 5 years, and their management. And we just saw immediately how the management for TB for Māori is just not good enough. So we can easily fix that.
Yeah, so we're just doing a situational analysis at the moment. Unfortunately, our Vina's not well today, but she's halfway through doing interviews and focus groups with public health teams, there's public health nurses, whānau patients who've had TB and their whānau members as well as policymakers, national policymakers. So we're trying to line up an interview with Aisha Verrill, who was involved in developing the policy. And our PhD student Daryl, who had beautiful Pepe here today, she's doing her PhD on the whole project for 3 years, and is currently in the process of doing a literature review, I think grey lit and everything. But our 4 processes that we're going through are there. We probably haven't got time to talk about them right now.
One of the systems level things is that we're submitting Te Tiriti o Waitangi claim against the Crown for lack of action, institutionalised racism around TB. And I need to leave early. Apologies. I'm going to quickly say thank you to everybody and then jump on a plane. Going to go and talk to the Minister of Health, Minister Reti, tomorrow about a whole lot of stuff, including TB.
And Whiri.
And Whiri, of course.
And just super quick, this is just our project that just started a few months ago, Cancer Whiri 2. So it's an extension of the first one, which you've already heard about, but we're covering the whole cancer pathway until patients are tau or palliative, or whenever they're finished with us, really. And we'll be piloting that in Auckland with our Auckland colleagues, and obviously again at Waikato Hospital. Yeah. So
And you can see Moa Huia Goza down the front. She's the she's just
in blank.
in black. She was just the CEO of Hei Ahuru Moa, the National Māori Cancer Leadership Group. And she's on the team to develop, or to not develop, because we've already got a mātauranga approach to whiri, but just to kind of express that more eloquently.
Framework.
Yes.
Yeah, a written framework.
Yeah.
And that's the team at our first hui up in Auckland in April, which was pretty cool. And I think that's enough.
Are we going over time?
Okay. Questions or? You have to do a closing, Nina.
Let's do one more big paki for the panel, the group. So I just want to do a quick summary of today and just quickly go through what we've heard today, because we've been pretty privileged and pretty blessed to have had the words of wisdom from people. So Tūreti was really clear that we have the answers and that we need to realise and action our own tino rangatiratanga and mana motuhake. And she gave examples of what they've done and how they've done it. And that whānau, and this was a similar theme that went through most speakers, that whānau being at the heart of everything that they do and everything that we should be doing, and not asking for permission. Karen and Lizzie gave us some realities for our whānau and corrections, and the respectful process that they were talking about for the end of life, and demonstrated their compassion and care. We were privileged to see Kerry Carr's video, and despite her journey, I heard her kōrero really clear around her thoughts for her mokopuna and the legacy that she leaves. We then had a Myra and Waimarama, and then Kara. So Myra spoke about the Whiri series in the hospital, and then followed by Waimarama and Kara around the community. but there was a really clear, again, another similar message around shifting the power, around equitable healthcare and responding to whānau. We then had feedback from the panel, so we had some more feedback there. And then at lunchtime, Michael and Myra managed to share the opportunity for us, if we choose to give feedback on the National Cancer Research Network. So there's still that QR code and the pieces of paper on your tables if you're wanting to participate in that, and encourage you to participate in that. The afternoon session, we were blessed with Te Orohi, and it was Libby, Arapera and Hinemoa, with the rongoa session that we had with Taonga Puoro and ngā taonga ngā mātua tūpuna, and remembering also the importance of te taiao. We then had Hamaima, and Hamaima gave us a really clear message, particularly around unconditional acceptance is where the heart work and the artistry begins. I love that, actually, because there should be always beauty in everything that we do. Joanna and Jamie. Joanna gave us a perspective from an initiative in the Cook Islands, and Jamie reminding us around a lot of the work and activities that the Māori Women's Welfare League have done. But both gave, 2 community responses with, again, whānau at the heart. We had Iki Muki, who reminded us around the mahi of the Health and Disability Commission, and the importance, of the Code of Rights and the rights for our patients. And whānau. And he also gave a clear message around infiltrating and influencing and using your position to do that. And I think that's a good reminder. And always, again, the words of wisdom, and there's lots of words of wisdom from Te Puia, mahi a te mahi hei painga mo te iwi. Then we've had this afternoon, we've had the Whiri research projects, giving the whānau consumer perspective from Vonda and Helena on their hauora journey, and then from the rest of the team, from Deanne, Nina, Amy and Lindley, who followed behind the scenes around the research, what was happening behind the scenes in regards to research. So we've been privileged to have, a great balance of practitioners, providers, supporting services, researchers, Mātauranga Māori practitioners, but most importantly, the voice of whānau. So if we look at all of those things, I think there's some key points for us to remember. Whānau are at the centre of everything we do. And if we're not, then we're kidding ourselves. So it's good for us to actually think and ask ourselves the hard questions. Actually, are whānau really at the centre of what we do? Are they really making decisions? Is our mahi that we do, working around what's needed rather than what's contractually required? And what are the things that we can do if we have to negotiate with our the funders around different things? But, giving feedback, we don't always have to accept what we get from the funders, that there's an opportunity to be more responsive to whānau. We also need everyone. We need everyone on board. Māori mā, Pākehā mā, everyone. We need all of our allies to work together to help make a difference. And that brings up the importance of networks, is that we need each other, not only to share and make it easier for each other, but to make sure that we look after each other in this journey. Working in hauora, or sickness, or hauora, or health, is like a marathon that never finishes. So, we've got to make sure that we look after each other. And then the other thing that that came through really clear, and it was echoed by a couple of people, was, and I think of that song, you got the power, ding, 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 ding. So we've got the power, we have the power. We're not, to make changes if we choose to. And we have to make sure that we don't always think that we have to ask permission for everything. It's always good to just do it and then ask, apologise later. But, there's lots of fantastic things that have happened, lots of fantastic initiatives that have happened with people just going and doing it. I'm not asking you to get the sack, but I want you to do that. I'll just make that clear, because we need you fellas to be there where you are. But yeah, there's just go for it. So just a couple of other things, and I've said them before. We're keen for you to give feedback on how you found the day. So there's an evaluation QR code there for you to scan and fill in. If there's any more food left on the table, either the table out there or the tables over here, please help yourselves and take it or give it to others who need it. If you can remember to leave your lanyards at the desk when you go out, so we can use those again. But I also want to do a particular big acknowledgement. There's a lot of work that goes into setting one of these days up. And I know from an email I received from Carice about 2:25 in the morning, she's sending the run sheet, you know. So I know that there's lots of people here. Some are here, some probably aren't even here or may have already left, that have done a lot of work to make today successful. So I just want us to all do a big paki paki for everyone that's helped. But I also want to thank each and every one of you for coming and supporting, because it's no good having all these fabulous people, but not having people who come and talk. Also, a big acknowledgement to each and every one of you as well. So before we close with kariki, I just want to hand it Nina. You got anything you want to say? Hand it to Nina for 2 minutes, and then we'll pass it to Mark to close us. Kia ora.
I wanted to say thank you to everybody as well, but you've already said thank you. So I'll say thank you to you, Tanya, for your wonderful emceeing and your mātauranga, and for keeping us all riveted for the entire day. Thank you. And I just want to say a second thank you to everybody who came today to listen and to speak. And I know everybody's doing a little bit of both. And it's just nice to have the opportunity to lift our spirits in these crazy times, because are crazy times and we need to take these moments, right? And thank you to the crew who's been working really hard in the little box all day, and you were here yesterday. And Carice and Tina have been working their butts off. I know they were here all weekend and up late at night, so I really hope you guys get a couple of days off. And but we've got another 2 of these to run, one in Wellington and one in Christchurch. So if you've registered, you'll be able to come in virtually. But just thanks for you both so much. So I'm going to go jump in a taxi now, but have a beautiful afternoon, and thank you all. And what's that? Oh yeah, okay. Can you guys read? No. So if you know anyone, please share the pānuis. These are our dates for Wellington and Christchurch. And yeah, hope you can either come in person or on the video and virtual. Oh, and Mark Whiteye, goodness me, where's Mr. Whiteye? There he is. He's going to close, and he's just wandering out the door. Oh, he's over there. Oh, that's Icky Mookie over there. Sorry, Mark. I'll give you a hug, but you don't want my cold. Thank you, Mr. Whiteye. We always appreciate you. And I know it was just because you were walking down the corridor and we said, hey, can you come and help? You said yes. So thank you once again. So kia ora.
So just before Mark speaks, I've just got a message. Can you please ask the crowd to carry their turu, so carry your seats at the end to the corner closest to the stage. Is it that the corner or this corner? So when you finish, if you can help us clean up, that would be appreciated. And just put your chairs over there. So, because you fellas aren't manuhiri anymore, so you've got to help do the work. There we go.